Welcome to the Omnidental podcast. We've all had that universally frustrating moment, right? You were staring into the bathroom mirror, you sort of tilt your head so the light catches your smile just right, and bam!
Oh, yeah. You spot it.
Exactly, you notice this weird, opaque white spot on your tooth. And your first instinct is probably to just grab your toothbrush and scrub it, thinking it's, I don't know, a stubborn patch of plaque or something.
Right, but it doesn't wash away.
It doesn't. And that's because you aren't actually looking at a clean spot. You might actually be looking at the microscopic collapse of your enamel.
It is a phenomenal illusion of biology, really.
Yeah.
We're so conditioned to view our teeth as these solid, unchanging blocks in our mouths.
Yeah, like little stones.
Exactly. But a tiny discoloration like that chalky white spot reveals a much more dynamic reality. The mouth is essentially a window into your overall systemic health.
Which is pretty crazy to think about.
It is. These specific marks act as a living record. They tell a really complex story about your oral microbiome, your childhood development, and even your nutritional history from decades ago.
Well, today we are taking a deep dive into this exact dental mystery. We are pulling from two really specific sources straight from the Omni Dental and Med Spa website and blog, dated April 3, 2026.
Yeah, some really great material there.
For sure. Our mission today is to decode what actually causes those chalky white spots and then explore how Dr. Billis Poles and the team at Omni Dental handle both the health and aesthetic side of your smile.
Because if you know what you're looking at, that spot stops being a mystery and becomes a very clear warning sign.
Okay, let's unpack this. We'll start with the most immediate factor we found in the research early stage tooth decay. But, I have to admit, genuine confusion here.
Oh, how so?
Well, from the time we are kids, we associate cavities with dark black or brown craters. A bright white spot seems totally contradictory. How can something so bright be a pre-cavity?
What's fascinating here is the microscopic chemistry of your oral microbiome. Your mouth is home to this massive, complex ecosystem of bacteria.
Right, the plaque.
Exactly. When you eat, particularly fermentable carbs or sugary foods, you aren't just feeding yourself, you're feeding those colonies of bacteria. And as they consume the sugars, they excrete lactic acid as a byproduct.
So they are essentially creating localized acid rain directly on the tooth surface.
That is a perfect way to put it, yeah. That acid rapidly lowers the pH level of your mouth. When the environment drops below a critical pH threshold, which is around 5.5, the acid begins to leach essential minerals out of the tooth surface.
Mostly calcium and phosphate, right?
Correct. This chemical extraction process is known as demineralization.
Okay, but why does losing minerals turn the tooth white? And I take minerals out of a rock, it doesn't suddenly turn into chalk. Why doesn't the tooth just become transparent?
Well, it comes down to optics and light refraction. Healthy, heavily mineralized enamel is incredibly dense, and because of that density, it is slightly translucent.
Like glass, kind of?
Yeah, exactly. Light passes through the crystalline structure of the enamel and reflects off the yellowish dentin underneath, giving teeth that natural glassy appearance.
Ah, okay.
But when the acid strips away the calcium and phosphate, that crystalline structure becomes highly porous. It gets completely hollowed out with millions of microscopic voids.
So it turns into a microscopic sponge.
Yes, and when light hits those microscopic voids, instead of passing through cleanly, it scatters in every direction.
Oh, wow.
So the area completely loses its glassy translucency and appears dull, opaque, and chalky white. That visual chalkiness is the physical evidence that the protective shield of your tooth is actively dissolving.
That is wild. It's basically an optical illusion hiding microscopic structural damage. The tooth isn't getting cleaner, it's getting hollowed out from the inside.
Right. You aren't seeing a stain. You're seeing the altered physics of light bouncing off a collapsing structure. And because it's porous, it's incredibly vulnerable.
So if you just leave it alone...
If the demineralization is allowed to continue, those microscopic voids merge, the surface eventually caves in entirely, and boom, you get that classic dark cavity.
So catching it while it is still just a white spot means you are intervening before the physical collapse even happens?
Exactly.
So that explains the external attack. The acid is eating away at otherwise healthy enamel. But what if the enamel was never healthy to begin with?
Right.
What happens when the tooth is structurally compromised before it even erupts through the gum line? The sources introduced a completely different mechanism for this, called enamel hypoplasia.
Yeah, this takes us out of the present day and back into your early childhood. Enamel hypoplasia is a condition where the enamel simply fails to form properly during embryonic or early childhood development.
And to grasp this, we need to talk about ameloblasts, right?
Yes, ameloblast.
These are like the biological manufacturing plants for enamel.
Exactly.
Mm.
They are highly specialized cells responsible for depositing enamel proteins and minerals, while the adult teeth are still developing deep inside the jawbone, long before you ever see them.
Okay, makes sense.
But these ameloblasts are incredibly sensitive to systemic disruptions in a child's body. If a child experiences a severe nutritional deficiency, particularly a lack of calcium, phosphorus, or vitamin D, those cells are literally starved of raw materials.
And vitamin D is the biological key that unlocks the body's ability to absorb calcium from the diet in the first place, right?
Spot on. Without sufficient vitamin D, you can consume all the dairy in the world, but the ameloblasts won't have access to the calcium they need.
Wow.
And it isn't just diet either. If a toddler suffers from a severe infection, a high fever, or even certain metabolic disorders during a critical growth window, the ameloblasts undergo trauma. They either stop working properly or they shut down altogether in specific localized areas.
So enamel hypoplasia is basically like building a brick wall, but accidentally using sand for a few of the bricks. The wall is up, but those specific spots are fundamentally fragile.
I love that analogy. Yes, it's a structural defect built right into the foundation. And years later, when that adult tooth finally pushes through the gum, it emerges with a permanent defect.
Like a chalky white spot or a groove.
Right. And this puts those specific teeth at a massive disadvantage. We just discussed how an acidic environment creates microscopic sponges in healthy enamel. If a tooth erupts with enamel hypoplasia, it is already porous.
So it doesn't even need the acid to start the breakdown process.
Exactly. It's already halfway to a cavity. The enamel is thinner, weaker, and highly susceptible to our modern diets, which are heavily saturated with acidic beverages and fermentable carbs.
Which brings us to a really fascinating contradiction in our research. Here's where it gets really interesting. If we need minerals to build strong teeth, we have to talk about the ultimate dental double-edged sword, fluoride.
Oh yes, the fluoride paradox.
Right. I mean, since we were kids, fluoride has been marketed as the undisputed superhero of dentistry. It's in municipal water, it's in our toothpaste, dentists paint it onto our teeth in those little foam trays.
It's everywhere.
Yet we are now looking at evidence that fluoride is actually one of the primary causes of these opaque white spots. How can the superhero also be the villain?
Well, it is a classic paradox of dosage and timing. The condition we are looking at here is called dental fluorosis. To understand it, we should look at the chemistry of why fluoride is used in the first place.
Okay, let's hear it.
When applied topically to an erupted tooth, fluoride interacts with the enamel surface. It literally replaces the hydroxyl ion in the tooth's natural structure to form a new compound called fluorapatite.
Fluorapatite.
Yes, and fluorapatite is vastly more resistant to acid attacks. It requires a significantly lower, more acidic pH environment to dissolve compared to regular enamel.
So it essentially upgrades the structural armor of the tooth.
It hardens the outer shell beautifully.
Yeah.
But the complication arises during development. Dental fluorosis strictly happens during childhood, usually before the age of 8, while those permanent teeth are still forming under the gums.
Ah, while those ameloblasts are working.
Right. Those sensitive ameloblast cells react poorly to excess systemic fluoride in the bloodstream.
But what actually constitutes excess? Are we talking about, like, drinking too much tap water?
Usually it traces back to young children habitually swallowing sweet-tasting fluoride toothpaste instead of spitting it out.
Oh, the bubblegum flavor gets them every time.
Exactly. When that excess fluoride enters the system during that critical developmental window, it disrupts the ameloblast function. It triggers localized hypermineralization in some areas and hypomineralization in others.
So the internal manufacturing process gets completely scrambled.
Yes, leaving you with these hypercalcified clouds trapped deep inside the tooth structure. The proteins within the developing enamel don't break down and clear out the way they are supposed to.
And that alters the way light passes through, giving you those visible, cloudy white streaks.
Right. But it is entirely a developmental issue. Once the teeth have fully formed and erupted, you cannot develop fluorosis, no matter how much fluoride you ingest.
Which makes sense why pediatric dentists are so adamant about monitoring a toddler's toothpaste usage.
Exactly. You only need a smear for a toddler. You want the topical benefits for the baby teeth currently in the mouth without overloading the adult teeth still forming in the jaw.
Okay, so we have a very clear picture of the culprits now. We've got external acid attacks, hollowing out the enamel, developmental cellular misfires from missing vitamins, and mineral overloads scrambling the internal structure.
That sums it up nicely.
But if I'm looking in the mirror at one of these spots, I know I can't just brush harder. The structural damage is already there. So how do we actually get rid of them? Are we just painting over the problem with things like whitening and veneers, or are we actually healing the tooth with remineralizing treatments?
That is the crucial distinction that dictates the whole treatment plan. Let's say it's early stage decay, that demineralization phase where the enamel has become a microscopic sponge. We have to force minerals back into those microscopic voids before the entire structure caves in.
Okay, the remineralization process. But wait, if remineralization is just putting minerals back in, why doesn't drinking a gallon of milk or chewing on some calcium supplements do the exact same thing?
It's a fair question. Systemic calcium from your diet is crucial for overall bone health, but it does not spontaneously fuse to the outside of an erupted tooth.
Gotcha.
Your saliva naturally attempts to remineralize your teeth throughout the day, but our modern high-sugar diets usually overwhelm that natural buffering system. So you need a highly specific, supersaturated chemical environment.
Enter the professionals.
Exactly. Dental professionals utilize highly concentrated fluoride varnishes or amorphous calcium phosphate treatments. These are formulated to adhere to the tooth surface and slowly release mineral ions directly into the porous enamel matrix.
So it's less like rebuilding a brick wall and more like grouting a tile floor before the tiles actually crack. You're forcing a specialized compound into the microscopic spaces to seal the surface.
That is the perfect visualization. The enamel matrix absorbs these ions, recrystallizes, and effectively heals the microscopic damage. As the voids fill in, the enamel regains its density and natural translucency.
And the white spot fades simply because the structural integrity has been restored.
Right. But, and this is a big but, what if the spot is caused by enamel hypoplasia or fluorosis?
Right, because those aren't actively decaying from an acid attack. They are inherent developmental defects. You can't grout a tile floor if the tiles themselves were manufactured incorrectly at the factory.
Precisely. You cannot remineralize a tooth that never formed correctly in the first place. For those issues, the approach shifts from structural healing to aesthetic camouflage and physical protection.
So that's where the whitening or veneers come into play.
Exactly. Whitening elevates the shade of the surrounding healthy enamel so the white spot blends in.
But what about severe cases of hypoplasia where the enamel is actually dangerously thin and vulnerable to breaking?
That requires physical coverage. Dental veneers are custom-crafted shells of porcelain permanently bonded directly to the front surface of the tooth. They completely mask the discoloration, but structurally, they act as an artificial enamel layer, protecting the sensitive tooth underneath.
Which really highlights why proper diagnosis is everything. You need a clinician who can look at that specific spot and determine if it's an active acid attack needing grout or a childhood fluoride streak needing a shield.
Absolutely.
And that leads us perfectly into the approach taken by Dr. Bylis Poles and the team at Omni Dental in MedSpa. They're situated at 305 E Rand Road in Arlington Heights, Illinois. And their service area is huge. They serve Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
It's a massive footprint, and the integration of services at their practice is really what stands out in modern healthcare. They aren't simply filling cavities in a vacuum.
No, they've merged comprehensive dental care with a full aesthetic med spa. So what does this all mean? I mean, their service list is incredibly expansive.
It really is.
Obviously, they handle general dentistry deep cleanings, laser therapy for gum disease, full arch dental implants, Invisalign, but they also offer injectables like Botox and dermal fillers, microneedling, laser hair removal, and even IV drip therapy.
Which is fantastic.
But on the surface, a dental clinic offering Botox might sound like a strange combination to some people. But when you look at the underlying logic, it's actually a massive paradigm shift.
It is the shift toward holistic facial architecture. Historically, dentistry and facial aesthetics were entirely siloed disciplines. But think about the underlying anatomy. A highly trained dentist spends their entire career intimately studying the complex musculature, skeletal structure, and nerve pathways of the face and jaw.
Right. I mean, your jaw is literally the foundational scaffolding for your entire face.
Exactly. Consider Botox. Most people view it purely as a cosmetic wrinkle reducer. But dentists utilize neurotoxins in the master muscles of the jaw to treat severe bruxism, or teeth grinding.
Oh, wow.
By relaxing those specific muscles, You relieve chronic jaw pain, protect the expensive dental work from being ground away, and simultaneously slim the patient's facial profile.
The aesthetic benefit and the functional dental benefit are inextricably linked.
Right. When Omnidental designs a restorative treatment, say porcelain veneers, to fix severe hypoplasia, they evaluate how that structural change affects the patient's lip support and overall profile.
If you are rebuilding the scaffolding, you might as well address the exterior at the same time, handled by someone who intimately understands both.
It elevates the standard of care from simply fixing a broken tooth to restoring a patient's overall well-being. By combining advanced diagnostics and an incredibly broad scope of treatments, Omnidental provides a cohesive, unified approach.
So let's tie this all together. We've been on quite a journey today. We started with a simple glance in the mirror at a chalky white spot, and we've explored how it could be the microscopic collapse of enamel from a highly acidic environment.
Or a cellular misfire during childhood development due to a lack of vitamin D.
Right. Or an overload of fluoride scrambling the manufacturing process. But the ultimate takeaway is that early detection is what gives you options. Whether you need a specialized remineralizing varnish or a custom porcelain veneer, the expertise at Omnidental and MedSpa can map out the precise solution.
The scientific tools are incredibly advanced today, but they rely entirely on proactive patient involvement. You have to take the first step.
Absolutely. If you are in the Arlington Heights area or any of the surrounding communities we mentioned, consider this your reminder to visit Omnidental to keep your smile structurally sound. You can reach them at 847-483-8833.
And, think about this as we wrap up. Because human enamel does not regenerate organically on its own, your teeth are essentially living fossils of your health history.
Wait, really?
Yeah. Every white spot from a childhood fluoride overload, every weakened patch from a severe fever years ago is permanently recorded in the crystalline structure of your mouth.
That is incredible.
It makes you wonder, what else is your smile silently broadcasting to the world about your past that you haven't even noticed?